Welcome. Thank you for your interest in the REACT program and for your participation in this webinar. My name is Darren Baumeister, the REACT Program Manager at Coverys. REACT, which stands for Respond Effectively and Communicate Timely, was launched in 2008 and is designed to address the needs of Coverys policyholders and their patients after an adverse event has taken place. The program offers assistance to participating healthcare providers, helping them respond promptly and effectively to the needs of their patients, thus contributing to the continuation of the treatment relationship. This webinar will introduce you to REACT and will provide you with an overview of the REACT program, explaining why Coverys offers REACT, what assistance is available through REACT, who is eligible for the REACT program, how policyholders participate in the REACT program, and where to find additional information on REACT. Why has Coverys made the REACT program available? This program is consistent with Coverys' recommendation that whenever a patient experiences an adverse outcome as a result of a treatment, therapy, medication, or surgery, the healthcare provider should offer a disclosure and express empathy to the patient. Moreover, Coverys recommends that when appropriate, an apology should be offered to the patient and/or family. The rationale behind the program is that despite all of our best efforts, adverse events still happen. When they take place, patients want to know what happened in their medical care, and they expect honesty and empathy from their healthcare providers. Through the REACT program, Coverys offers its policyholders consultation and guidance regarding disclosure and, where appropriate, apology, education resources to support the healthcare provider. This includes materials and references on the topic of disclosure, online just-in-time programs, and CME programs. And finally, financial assistance to reimburse patients for some of the expenses that may have resulted from the adverse event. So what kind of financial assistance is available to eligible patients under the REACT program? First, there's reimbursement for out-of-pocket medical expenses. Patients experiencing an adverse event may be eligible for reimbursement of up to a maximum of $25,000 for out-of-pocket medical expenses. Reimbursements are payable only to the extent that they are not covered by the patient's health insurance coverage or other applicable plans. Any reimbursement made by Coverys under the REACT program does not reflect an assessment of whether there has been a departure from the standard of care. Some of the typical out-of-pocket reimbursements include deductibles or copays, ambulance charges, prescriptions and over-the-counter medications, child care, and transportation and parking. Because patients may be unable to participate in their normal daily routine as a result of an adverse event, the REACT program may also recognize their loss of time by offering them payments of $100 per day for up to 50 days, regardless of employment status. So, if, for example, the patient is expected to have 3 days of recovery following their surgical procedure, and now, as a result of an adverse event, they have 7 days of recovery, the REACT program would pay them 4 days of loss of time for those 4 extra days of recovery time. The REACT program is available to eligible policyholders who have their primary professional liability coverage with Coverys in states with an existing benevolent gestures law. For a list of states where REACT is available, contact the REACT Program Manager at react@coverys.com. How can eligible policyholders participate in the REACT program? Coverys policyholders must first submit a completed enrollment form to the REACT Program Manager. Insured facilities and groups may complete a single enrollment form on behalf of all those providers insured under the Coverys policy. No additional premium or fees will be charged for enrolling in and taking part in the REACT program. So what is eligible for the REACT program? To qualify for REACT, the patient must have experienced an adverse event. We define an adverse event as a harm resulting from the process of medical care rather than from the patient's underlying disease. An adverse event is not necessarily the result of a medical error or departure from the standard of care. In many cases, the adverse event may be a known complication of the procedure. Here are some general examples of adverse events taken into the REACT program. Included among the surgical injuries are bleeds or perforations following a colonoscopy, urinary injuries following a cystoscopy or hysterectomy, laparoscopic injuries. Keep in mind that not every adverse event is equally suitable for REACT. Therefore, Coverys has the sole discretion to determine whether a specific adverse event will be addressed by the REACT program. So what events are not eligible or are excluded from the REACT program? If the patient has already decided to pursue a claim or suit or retain an attorney, these cases would not be appropriate for referral to REACT. And in those instances, Coverys will ensure the provider receives appropriate representation. If you have a question about whether a specific event qualifies, please contact the REACT program manager. When reporting a matter to the REACT program, we offer these guidelines. If a patient experiences an adverse event, the provider should remain focused on addressing their clinical needs, then contact the REACT program manager at their earliest convenience. The provider should not tell the patient about REACT before discussing the outcome with the REACT program manager, nor should they make any promises on Coverys' behalf with regards to payments. For an event to qualify for REACT, it must be reported in a timely manner by the insured program manager. Because discussions with the patient are most effective when conducted soon after an adverse event, the REACT program manager should be contacted within 48 hours of recognition that an adverse event has taken place. This early response is optimal, but Coverys will make exceptions as long as the provider reports the event to the REACT program manager within 30 days. Physicians who experience an adverse event at a hospital or facility insured by Coverys should first report the matter to the risk manager or the quality and safety officer at their facility. Once the event is reported to the REACT program manager, the policyholder will be advised on whether the event is eligible for REACT. Once the event is accepted into the REACT program, the program manager will 1. Provide the policyholder with consultation concerning the adverse event. 2. Advise the healthcare provider on communicating information about REACT to the patient. 3. When the patient calls Coverys, the REACT manager will review the reimbursement process with the patient. The REACT manager will also keep the provider updated on the status. Here are some answers to some frequently asked questions about the program. First question, if I use the REACT program, can it be used against me? Answer, the REACT program is no fault. An adverse event is not necessarily the result of a medical error and may even be the result of a known complication. A payment made under the program does not reflect an assessment that there has been a departure from the standard of care. Will the REACT program obtain a release or settlement agreement from the patient? Answer, patients will not be asked to sign a settlement or release as a condition to receiving reimbursement under the program for out-of-pocket expenses or loss of time. This means that a patient using the REACT program can choose at any time to file a claim, but should they decide to file a claim, they will no longer be eligible to receive any further reimbursement through the REACT program. Are these payments reportable to the National Practitioner Data Bank or to my state medical board? Answer, no. Because these matters are not claims and Coverys does not ask for a settlement agreement or release as a condition for the patient participating in REACT, there is no reporting to either the data bank or the state medical board. I'm concerned that using the REACT program might be overly burdensome or confusing. Answer, the REACT program complements the policyholder's existing disclosure process and policy. Rather than make the disclosure process more burdensome, the goal of REACT is to provide the policyholder with additional resources so their process works better. Does the REACT program affect my Coverys policy? Answer, no. Bottom line, the REACT program has no effect on the policy. Participation in the REACT program does not change or amend any of the terms or conditions of the healthcare provider's Coverys policy. So what do users of the program say about REACT? In a survey of REACT users, the response has been overwhelmingly positive. 93% of those participating in REACT say that the program was either helpful or very helpful in maintaining a positive relationship with the patient. 94% of those participating in the program have expressed that they are very satisfied with the REACT program. Although none of us want an adverse event to happen, it's good to know that should one take place, Coverys has both the necessary services and professionals who can help. As we conclude this webinar, here are some key takeaway points. 1. Enrolling in the REACT program does not cost the policyholder any extra premium. The enrollment process is convenient and easy. 2. Should a Coverys policyholder experience an adverse event in their practice, they should call the REACT program manager within 48 hours. The REACT program manager will be able to review the adverse event with the policyholder and answer any questions about REACT. Lastly, if you have any questions regarding the REACT program, would like the enrollment form sent to you, or would like additional written materials, including brochures or disclosure cards, please email or call us. Our email is react@coverys.com. You may also call us at 800-225-6168. Thanks again for your interest in the REACT program. This is the end of our webinar.